Sir, actually, we are not able to hear you. Hello, sir, are you speaking? Hello.
Hello.
Sir, we heard
Guys,
you,
I'm
but
sorry.
there was a lot of echo.
Am I audible? Guys, am I audible now?
Yes, sir, now it is fine.
Yes, sir.
Okay, I'm sorry. I was working in the hospital. I'm trying to log in from the hospital system, but for some reason it didn't allow me. Maybe I don't know. There is some problem with the microphone or something. But I just logged on with my phone. So what I'll do is I'll do the presentation from my desktop. Meanwhile, I'm going to talk on the phone. I hope I'm audible to everyone, right?
Yes,
Yes,
sir.
sir.
Okay, guys. Karthik, thank you very much for that lovely introduction. And I'm sorry, like because I'm in the hospital, I could not turn on my camera. I'm doing this call from the hospital for the benefit of all the students, members of on the program for all the students who belong to this PSPP mentorship program. And it gives me great pleasure, to do this pharmacy D quality workshop for you guys. If you want to know about me, most of you know about me. You have heard me from my previous workshops or previous conferences I have participated and attended. My name is Satheesh. I'm working as the dean and chief preceptor at Vijnan Pharmacy College, Vadlamudi. Um, Myself, if you want to know my background, I'm a pharmacist. I worked in the US for about 10 years, and I also worked as a preceptor for Temple University and University of Sciences Philadelphia. And I don't want to talk more about myself because we have a big presentation. I just want to start with the presentation. Maybe we can chat with each other later. Let me start my screen just a second. Okay, it's here. All right. Just give me 1 second, guys. I'm trying to open my presentation. Karthik, I'm not able to see my presentation. Why is it so?
Actually, even we are not seeing.
Your presentation, like
Present now, a window. I'm only seeing the Google Chrome window, but why am I not seeing the presentation? I have the presentation on the desktop. Why is it not showing me when I hit present? I'm on the admin mode, right? This is Google Meet, so it should come. Ah, present my entire screen. Okay, our entire screen. Okay, okay. Okay, then it's saying you're presenting your screen, but where is my presentation? It's just the same screen, right? Ah, okay. Are you seeing this now?
Yes, sir.
Yes, sir.
Okay, can you see the presentation now?
Yes,
Yes,
sir.
sir.
Yes,
Okay.
sir.
Yes,
Okay,
sir.
nice. Okay, very good, guys. So today I'm going to talk about pharmacy D quality certification program. Why I'm saying this is, see, most of you guys who are working, who are in this, who are in this conference call, are either completing PharmD program or completed PharmD program, and you will be probably working in any of the hospitals, any of the healthcare industry, probably wherever you work, you should be aware of this certification because this is a certification program that builds quality, that emphasizes how much a hospital is putting attention for quality of the to show pharmaceutical care and building quality based initiatives to build best pharmaceutical care in the industry. Like I said, when you work in any hospital, nobody will say you have to do this only this way or you have to do something in other way. See, these protocols depends on what you start practicing and how you keep implementing them and how you keep updating them. Suppose you make a rule today, maybe that rule is okay for today and tomorrow it might not be. There could be some loopholes with that rule, or maybe the rule doesn't exist anymore. So one good thing with quality is you come up with an initiative measure, you implement it and find what is wrong and you update it. It is a quality continuous improvement process. Quality is a continuous improvement process. You cannot build quality overnight. So like I said, these are the two nice quotations I like to have in a presentation. Quality isn't expensive, it's priceless. Yep, anything that is of quality is, we all see that it is very expensive, but what we don't look at as really quality is priceless. And quality means doing it right when no one is looking. This is said by Henry Ford. Like a lot of people, even I see that with my students, when I'm in the hospital they behave differently, when I'm away they behave differently. So this is one thing, is quality is integrity. So if no one is there, if you're working in your pharmacy, there are technicians and you are working carefully and technicians are not there, you're just doing it haphazardly, that is not quality. So basically quality comes with integrity, so you do the right thing even when no one is looking. Let's go into the presentation. PDQ. What is PDQ? PharmCD quality. This has been brought into India by Abbott and in association with Bureaus Veritas. It's a global testing organization. These people test, inspect, and certify various industries, various hospitals, numerous Sorry, guys. These people check on numerous things. They certify various industries and give them a certificate of excellence. So with us in relationship to the Department of Pharmacy Practice or in relationship to the hospital, these particular organization bureaus veritas, they focus on pharmacies as center of excellence. Like in some hospitals we have some areas like departments of excellence. Cardiology is a department of excellence at some hospital, or a nephrology is a center of excellence at some hospital. So similarly, these certifications are based on only one concept, that pharmacies or pharmacy as a center of excellence. So what does this certification highlight, or what do they look when they come for a visit to your hospital? Normally, they look at the highlights of best practices of pharmacy, optimal services, evidence-based care to patients. And when I say these things, not every hospital can implement these things, because these things are very expensive, and it requires a lot of PharmD personnel to do these things. It also recognizes hospital pharmacy management contribution towards improving effectiveness of healthcare system, maintaining and improving professional performance, and providing effective medication therapy management. And I have been telling you from the beginning, all these things, they are not built overnight. In other words, you cannot start a hospital, a new pharmacy, put some people and say, okay, I'm doing quality care, I'm giving quality care. I would say that in my experience, it took me about 7 years to bring what I call quality into the hospital, uh, into the very intricacies of pharmaceutical care, where we are right now from where we have started 7 years ago. Because it is like a trial and error basis. We implement something, something doesn't work out, we go back, hey, why did this not work? What should I change? You change it to something that is more effective. So it's like I always stress on that quality only comes with continuous effort to bring quality. It's not like you put something and say, I put this, it is going to work. Unless you update that, it is not going to work after a period of time. So, and the most important thing is providing effective medication therapy management. See, every word, every sentence has a very depth meaning. Medication therapy management, that itself I can talk about for 3 hours. What is medication therapy management? But if you think what we are doing is medication therapy management in our hospitals is wrong. Majority of the hospitals, they don't do any medication therapy management, because medication management therapy is something where you collect the patient, you collect all the patient history, all the past medication history, all the social history, OTC drugs, nutrition supplements, you sit with the patient, you talk to the patient, putting all together, providing a very customized care. That is what is medication therapy management. So these are the best practices if you want, you should be doing if you want your hospital to be certified for PDQ. And before I go into the inspection of PDQ, because most of you, like I said, you are in the 5th year or you will be joining some hospital in a couple of months. So let us see what quality care standards are required in community pharmacy or in the hospital pharmacy. Because if you don't have these standards, these care standards, you cannot provide a good pharmaceutical care. So the quality care standards program should be established as a process of continuous quality improvement. Who implements this? The pharmacist or the pharmacist in charge or the clinical pharmacist should do this. And once you improve this is a 3-step or 3-stage process. So stage 1, stage 2 and stage 3, because you cannot just say that, okay, I'm implementing all the quality care practices. Unless it is audited by a third party and finds out how much you're implementing, we can grade that. So even if before you go for auditing, that could be by a third party or a self-audit, you should know how you can implement this the quality care standards in 3 stages. Among the 3 stages, the first stage is the minimum requirement. So what is the first stage? This is the minimum requirement for any pharmacy. So here you have 2 things, areas to be included and domains. Setting of the pharmacy, that is the first basic thing. If a new hospital invites you to come and set up a pharmacy, you should know how to set up a pharmacy even before you start working in your own pharmacy. So what they look at here is when you set up a pharmacy, what is the appearance of the pharmacy, and what is the accessibility of the pharmacy, the window dressing, dispensing area, counseling area. See, this is what they look in and give points and marks to. So when I say appearance of the appearance of the pharmacy should be very neat, clutter free. Like you should have all your drugs arranged in alphabetical order, or you should arrange all the antibiotics in a separate area, or eye drops in one area, your ear drops in one area, your nebulizer stuff like your inhalers, all that stuff, all the asthma stuff in one area. So, and you also have like look-alike, sound-alike medications. You have high-risk medications. So basically, how you arrange all these drugs in your pharmacy to prevent errors is what is the appearance and appearance of the pharmacy. Uh, like I always say that if in your house, just like your mother, if you look in the kitchen, she arranges all the groceries, all the spices, everything neatly in the kitchen, in the cabinet. Now, suppose if she's cooking something, she knows where exactly the cumin is, where exactly the mustard is, where exactly salt, sugar is, right? Without having to mix one and the other. So this is exactly how you arrange your pharmacy such that there won't be any mishaps. Accessibility. How well is it accessible to the people? I mean, do you have a ramp for people who cannot climb, or people who have disability and who use a wheelchair? Do you have accessibility if your pharmacy is in the hospital? Do you have access to the patients outside of the hospital, and patients who are coming into the hospital? Is your window area, dispensing area clutter free? All these things. How is your counseling area? Do you have the privacy? Do you have the distance between other people, so that when you talk to a patient, it is not overheard by the other people, and you maintain the confidentiality of your counseling? Do you maintain that? Do you have proper staffing? When I say staffing, everybody who works in the pharmacy should be either a certified pharmacist or at least a certified technician. That's what staffing is. It's not like anybody can come in and pull up medications and pull them and put them back. So do you have the right people to do the right task? All these things comes with setting of the pharmacy. Handling of stock and preparation of medicines. So next thing, now you set up the pharmacy. How do you purchase? See, we have local vendors, we have wholesale vendors. How do you purchase the medications? How do you stock them once they arrive at your pharmacy? What do you do? Do you have a triage area? Do you have a pre-inspection area? And after inspection, where you put them? How do you store them? Suppose if you are working in a hospital, majority of the people that in the hospital we have a bigger hospital will have a central pharmacy, a inpatient pharmacy, outpatient pharmacy, right? Usually there are three pharmacies: a central pharmacy which receives the drugs, and then the central pharmacy in turn supplies the medicines to the inpatient pharmacy and outpatient pharmacy. And all the medicines will arrive only at the central pharmacy. So after it is received there, what do? You have your invoice, right? You check what you have ordered and what you have received. Were all of them as per your order and intent you have placed, right? And then how do you enter them into the computer once the inventory arrives? Before you dispense, you have to upload that inventory into the computer such that it reflects equally well at all the places. Suppose if there is a new stock of augmentin syrup that came into the central pharmacy, and there is a prescription in the outpatient pharmacy, and outpatient pharmacy ran out of augmentin. Immediately, if you enter this into the system, a pharmacist who is working in the outpatient pharmacy can look in the computer and say, hey, you know what, please wait, our central pharmacy has maybe 10 or 20 bottles of the drug. I'm going to have it delivered here. Or we have some stock in the IP pharmacy. So this electronic perpetual inventory maintenance has to be very well maintained such that you don't run out of stock. Then maintenance of quality of stock, identification of expired products, recalled medications. This is one important thing you have to do. Every month, you should be checking for outdates. Normally, I recommend you to pull out anything that expires in the next 3 months, just pull it off the shelf, because I think it's time you pull it out and send it back to your processor who does the recalls and who does your outages or outdates. So how do you do that? You pull it every month. Do you pull the next 3 months? And sometimes we have recalls. What is a recall? Suppose a drug has an issue and the company wants to call it back. It's called a recall. They send you a notice. Okay, Reddy's Laboratories, so and so drug has so and so issue. Please send the drugs back. So recalls can be multiple levels. It could be at a dealer level, it could be at a retailer level, it could be at a patient level. So if it is something at the retailer level, you just send what all you have in the stock, you send it back. If it is a patient level, you have to pull up your computer invoicing system and find out who did you dispense in the last few days, and ask them to bring it back because it is a manufacturer recall. So that is what you have to do. And once they bring back in the pharmacy, you should give designated areas to store all the outdated stuff and all the recalled medications. You should not mix outdates and recalls, and you should keep them in a separate containers where it is clearly visible to all the members, all the people who are working in the pharmacy. Availability of standard operating procedures for extemporaneous dispensing. This is very important, but we don't do that a lot in India. Anything like compounding you make a suspension, you make syrups, you make emulsions, you make suppositories, right? There is a standard operating procedure for everything, like probably when you're doing your compounding lab or when you're doing your dispensing lab in your PharmD program, there is a SOP, right? I mean, step 1, weigh this much amount of this. Step 2, weigh this much amount of that. Step 3, mix them together. Step 4, heat them for 10 minutes or heat them until the temperature comes not more than 40 degrees. Step 5, cool your suppository molds. Step 6, pour this whatever the molten mass into the mold. This is a standard operating procedure. So for everything, you should have a standard operating procedure if you are doing any extemporaneous dispensing or compounding things in your pharmacy. And then documentation of extemporaneous preparation. So what do you do? Who did you dispense to? How much did you dispense to? That documentation is very important. Storage of raw materials. We really don't have much raw materials because we don't do any compounding. Suppose if you're doing compounding, say you're making a suppository, then you need to have the drug, you need to have cocoa butter, you need to have emulsifier, you need to have all these things. But because we don't do much of any extemporaneous preparations in our pharmacies, in India, we don't have any raw materials. But if you have, you also have to store them very safely and securely. And then provisions of prescription medicines. Prescription receipt and patient identification. Yes, this is a must. Every person who comes to your pharmacy, you have to provide a prescription receipt saying that what medication was given, what is the price and all that information. And patient identification. Normally, again, that we don't have, but you see how patient identification in the hospitals. Suppose if a patient is admitted in a ward, right? The inpatient pharmacy distributes medicines to all the patients who are admitted into the ICUs or who are admitted into the wards or who are admitted into, say, ICUs or wards or emergency rooms or casualty, wherever they are. So as soon as the patient gets admitted, the patient is given a number called UMR number, Uniform Medical Record Number, or Universal Medical Record Number, which is universal again across all the platforms of the hospital you go to. And then there will be also one more number called IP number or inpatient number, which identifies the time the patient was admitted into the hospital. So normally, if you are dispensing those medications, these numbers were to be, because we don't use the patient name, so we usually use identification number for inpatient medication requests. Prescription checking. Once you fill a prescription, how do you check the prescription? Whatever the doctor wrote, whatever your technician pulled, is it the same thing? Is the dose same? Is the duration same? What did the doctor write and what are you going to counsel the patient? So that's all. The prescription checking is the most important thing. In India, what we do is we have blister packing, we have unit dose packings, we just dispense as such. But in advanced countries like America or Canada, we don't dispense unit packaging things because the drugs come in a pack of 100 or 500 count, where we literally count 10, 15, 20, 30 tablets. We put in a bottle, put a label and give. Because these standards were really written putting in mind the best pharmacy practices across the world. So that's why maybe some of the things which I'm going to talk here, you cannot correlate with what you are doing especially in India. But it's okay. I'll try my best to make entire sense of what I'm talking today. Then provision of information on the use of medications. Normally in US, if you go to a pharmacy, for every prescription, your pharmacist will give a monograph. A monograph will tell you what is this drug, what is the dose, how many times you should take it, what to take with the medicine, what you should not take with the medicine, what are the possible side effects of the drug, and what you should do if you experience any of the side effects. So this is one page sheet. This is called a monograph. This normally we give it to the patient along with the medicine, but in India we don't do that. So that is a very basic requirement because the patient deserves to know what medicine they are getting and what it is used for and what are the adverse effects of the medicine. Dispensing, the actual dispensing procedure of the medicines. Then supply of non-prescription medicines for self-care. Advice on the selection of medicines. A lot of times we see that people who are diabetic, they come to the hospital or pharmacy and they ask the pharmacist so many questions about non-prescription medications, or especially sometimes they ask questions about herbal medications. Sometimes a person, so a person who is a person who is like put on some medications wants to know, hey, if I have an occasional headache, can I take paracetamol? This is something because paracetamol doesn't need a prescription. It is an over-the-counter drug in many of the countries. So it depends again. Suppose the doctor already prescribed, say, something which I can make you understand. The doctor prescribed a patient for Combiflam. Combiflam is a combination of ibuprofen and paracetamol. Patient doesn't know that. Patient thinks this is Combiflam. And patient can come and ask you, if I have any headache or fever, can I take paracetamol? So this is something where we see more frequently. In that case, you can tell the patient that this drug contains paracetamol. You don't have to take paracetamol separately. Or if you want to take paracetamol, skip this Combiflam and then switch to paracetamol. That is non-prescription medications. Responding to minor ailments, yeah, like first aid, anything minor ailments, like sometimes people get burns or scales, or people get a cut on the finger, or cough, something like cold, any of these things, any of the minor ailments, people call and ask you, you should be able to answer their questions. And this is something you have to do it on a day-to-day basis. And these are, whatever I'm talking now is stage one. Those are the minimum requirements. So this is expected that this should happen. Without this, a pharmacy cannot exist. Interaction with patients. Is the pharmacist interacting with the patients? In which way? What are his communication skills? Because there are two kinds of communication skills, verbal and non-verbal. How the pharmacists are talking to the patients. Suppose you want to talk to the patient, and there are language barriers. Suppose a patient from some other place comes here, he doesn't know Telugu and you don't know English. What are you going to do? You're not going to have good communication with them. And this is just, I'm talking about the verbal communication. Non-verbal, how your body language is. Always when you talk to a patient, you should show a body language that shows concern for the patient. You should not be reckless or careless. That is a very bad perspective from your end. Provision of advice on safe use of medicines and the management of disease conditions. So this is one important thing. So somebody who has asthma, they're using inhalers. Maybe they don't get a relief. Usually what they do is they keep on taking more inhalations, thinking that if I take more, I'll get better. Again, is it really safe to use that much? That is what you have to talk to the patient. And if you're using an inhaler and if it is not coming down, that is the time to see a doctor. So how to manage that condition? See, all these things, disease conditions, like sometimes the management of a disease condition can be as simple as non-pharmacological methods. Suppose somebody with hypertension, you can recommend them to to exercise regularly. You can recommend them dietary approaches to stop hypertension. You know what to eat. Not always management of the disease condition is pharmacological. You can also counsel them non-pharmacological methods, food, diet, exercise, alcohol, smoking, all these things. You can talk about how well you can manage a disease condition. Promotion of good health. So this is very, very important these days, especially considering the corona COVID-19 going on right now. So how do you promote good health, good hygiene, vaccination, proper vaccination at the right time? So you professing vaccination program and you asking people to follow proper hygiene and all these things. You can promote good health in so many ways. Eating good food itself is a very simple tip you can give to anybody, rather than eating junk food like a lot of people eat pizzas or burgers that is very high in fat content, which is very dangerous for the health. Rather, you can make a simple choice like you can go with a healthy snack, which is a fruit, a serving of a fruit, or a serving of any of a vegetable like tomatoes with salad, something like that, which is much good for the health. Provision of written information, labels, and leaflets. This probably in the sixth year, many of the PharmD students will be doing that. You will be making pills, patient information leaflets. So you can take up a condition for diabetes. You make a patient information leaflet, what to do, what not to do, what is hypertensive urgency, sorry, what is hypoglycemia, and what are the symptoms of hypoglycemia. You can make them understand that what to do in hypoglycemia, right? You can take one disease condition and make a patient information leaflet or a label. Documentation systems, patient medication profiles. Again, whatever I'm talking, majority of that you don't practice in India. But again, I'm so sorry, but this is how you have to do. Patient medication profile is, it's how can I put it this way? Okay, if you go to, okay, bank is a good system that maintains complete profile of a customer. Suppose if you download your any of the mobile banking app, or if you go online logging to your mobile banking, it shows you how much balance you have, when did you add money, when did you withdraw money, how much amount you have done, how much fixed deposits you have, right? Similarly, you should maintain a complete patient medication profile. Okay, what allergies the patient has, what are the disease condition the patient has, what medications the patient is taking from your pharmacy. Okay, is the patient picking up the prescription regularly? So this is a profile that contains every time a patient visits the pharmacy, whatever the medications they buy, it goes in his profile. So even after like 2-3 years, if you can just go to the patient profile and see what medications they have taken, have they been regular in using their medications, all that kind of things you can look from a patient medication profile. Formulary systems, that is very important for a hospital, because for a doctor to prescribe medications, every hospital should have a hospital formulary, and the formulary should be regularly updated and maintained to the current prescribing guidelines, rules, and regulations, including the most novel latest drugs that are being launched and introduced into the market. Policies and standard operating procedures, documentation of pharmacist interventions. All these things, if you look, this is all documentation, because when they come for an audit and they ask you, okay, you did something wrong, did you document that? Yes or no? Next question. Okay, you documented. How did you make effort, or what efforts did you take and to prevent the same error happening again? See, all these things, see, what I'm telling you is, see, to make an error is human. People make errors. But the question is, are you learning from that error and making sure you don't repeat that? That is the most important thing. So that's what they look. They don't, penalize you for making small mistakes, but they'll ask you, okay, you made a mistake. What measures have you taken to prevent the occurrence of the same mistake again? You need to show a documentation. And pharmacist interventions, or whatever. Suppose there is a patient has been prescribed 2 drugs, say clopidogrel and say aspirin and one more nicorandil, all right? Or if the patient is prescribed multiple drugs which are going to interact with each other, or if there is a chance that these drugs could cause harm to the patient. Suppose, like I said, a patient is using aspirin, clopidogrel, and let me put the latest rivaroxaban. So all these 3 drugs, are going to reduce, they're going to reduce the viscosity of the blood, or they're going to cause the circulation of the blood. So if there is an injury, there is a chance that the blood will not clot. So does this patient require all these 3 medications? That is the question. So you can intervene in, again, this you cannot do in India, I'm telling you, but this kind of practice you do in any other country, yes, you are allowed to do these interventions. So you can call the doctor and say, hey doc, you prescribed these 3 drugs, but again, the patient's INR is so and so. I don't think so we need 3 drugs, because the INR will still further go down, which is not good. So these are the things which we always do, in any of the advanced countries. And again, I'm talking only the minimum requirements. Now let me go to stage two. So apart from the minimum requirements, that is my whatever I'm saying, my minimum requirements or my like my infrastructure, or I could say my how can I put that? Like a route to the plant. It is like when you construct a building, right? You make a foundation. So this is like a foundation to the building. So how well you can take it further? That is stage two. So in stage two, again, equipment. So when I say equipment, like I said, cleanliness and good state. So you can have so many equipment, if they are not working, there is no purpose of having such equipment. Suppose in olden days we used to have mercury thermometers, but nowadays we have most advanced digital and most very accurate and very high speed thermometers which can take temperature readings even without touching the patient. So are you maintaining the most advanced technology and equipment required to provide a quality care, and how clean they are and how good they are? Routine maintenance and validity. So you have a thermometer. Are you validating it? Every time you take a temperature, is it showing right? Suppose you have a glucometer. You have been testing those patients' capillary blood sugar. You can check the validation of the meter. Is the meter giving correct reading all the time? How do you know? You have a control solution, you have to validate that. Again, if you have sphygmomanometers, are they showing the correct reading? Again, you have validation for that. So you have to do certain maintenance and validity to make sure that they are working correctly and the data showing or whatever the readings they are showing is correct. Availability of refrigerator, counting devices, and other dispensing equipment. This is very important because if you have insulins, if you have any of the refrigerated medications, you definitely have to store them at 2 to 8 degrees centigrade. Suppose if you are dispensing vaccines, some of the vaccines are frozen, like shingles vaccines, Zostavax is a frozen vaccine, you need to have a freezer. And again, refrigerator is different from a freezer. Please don't confuse that. Freezer is something where the temperature is less than minus 2 degrees. So because that is the temperature you store those some of the vaccines at. Even our one of the upcoming and latest coronavirus vaccines, they need to be frozen. Not all vaccines are stored in refrigerator. Some of the corona vaccines are has to be stored at negative temperatures. So do you have the availability of this equipment? Counting devices, I told you, in advanced countries, we have a 100 count bottle where we count like 30, 40, 50 tablets. We put in a bottle and give. So where are you going to put those tablets? On your table? No, you need to have a decent counting trays and spatulas. You're not supposed to touch them with your hands because that is unhygienic. So other dispensing equipment. Reference drug information systems, your pharmacopoeias, your micromedics, lexicon, British National Formulary, as simple as SIMS, MIMS, any of the books which you can use to refer drug informations. Do you have them? Because if somebody asks any questions, you should be able to locate them immediately. Health promotion activities, distribution of leaflets, display of health promotion advertisements, participation in health promotion campaigns, all these things. What health promoting activities you are doing from pharmacy? Are you distributing leaflets to the patients? Suppose somebody brings you a prescription of metformin. Okay, you know that the patient is suffering with diabetes. You can have some information leaflet on diabetes and give it to the patient, which tells what to do, what not to do, what to eat. Now, it tells everything, how to manage diabetes very effectively. Not something like that. Then display of health promotion advertisements. Like this nowadays we have seen this vaccination for Covishield and Covaxin, right? So health promotion advertisements, like, okay, you can do wellness camps. You cannot promote drugs. You can't say you take this drug, you get better. You cannot promote drugs. You can promote health. Remember that promoting health is different from promoting drugs. Two different aspects. Because when you promote health, you say that simple. When you're promoting health, a small sign that promotes health can say as you can say that wear mask at all times, use hand sanitizer, maintain 6 feet distance between people, especially during these times. This is promoting health. You're not promoting any drug. Okay, that is two different things. Promotion, health promotion. Participation in health promotion campaigns, like doing mega health camps, where you go, you do a BP screening program or a diabetes screening program or a cancer screening program, any of the screening programs, a dental screening program, you go and You keep doing these programs to promote dental health, like you go with the doctors, you check the dental, the teeth of the patients, and if you find any cavities, whatever you can do at that level, you do, and then you can ask the patient to come to the hospital to get it treated. A lot of times I do, even at our college, we do a lot of, not this year, normally every year we do a lot of medical camps, and we do a lot of screening services, blood sugar, blood pressure. One time we even did ECG for a medical camp for all the patients who came there. We do hemoglobin screening, we do BMI. So this tells us if anything is wrong, we advise the patient. Sometimes patients don't even know they have hypertension, they have diabetes, but they are not aware of it because nobody told them. So in these screening programs, something like that comes up and you can advise the patient to go see a doctor. So all these things are health promotion activities. Then again in stage 2, diagnostics, provision of diagnostic tests. Example, this is what I'm saying: blood pressure monitoring, blood cholesterol testing, glucose monitoring, peak expiratory. See, all these things are pretty simple things. Pregnancy testing, body weight monitoring, because they don't require any invasive procedures. Not at least, you all you need is capillary blood. That's it. So in America, what we do is we maintain all these things beside the pharmacy. We have an automatic blood pressure monitoring system where they come, they put the hand in the ring, and it inflates and measures the blood pressure and shows it to the patient. And the same like the way how we do blood sugar monitoring, we also have a device to do blood cholesterol testing. All you need is a small drop of blood. You put in that strip and it shows what the patient's cholesterol, total cholesterol, LDL, HDL levels are. It doesn't give me much idea about in-depth analysis, but it gives me the basic things: what your HDL is, what your LDL is, what your triglycerides are. That is what your total cholesterol is. That is more than enough for me to guide the patient to a doctor, saying that, hey, these things are abnormal. You might have to check with your doctor. And pregnancy test, EPT, early pregnancy test. Nowadays it is over the counter. It's pretty simple test. All it needs is a early morning urine. There is a plastic device with a small absorbent tip. You just put urine on the tip and you see it. You can find it out yourself. It's pretty simple. It is very user friendly. It does not require much skill. See, suppose a small example I would like to quote here, user friendly, our blood pressure monitoring systems. We have 3 different kinds of systems, right? The one that is manual, where you have to have certain skill to do that. Then we have semi-automatic, and then the automatic ones. In semi-automatic, again, there is a little bit of skill. You have to pump the air, and that will take care of inflating and deflating. But if you look at the completely automatic blood pressure system, you do nothing. You just put that cuff on your hand and you just push a button. It does everything by itself. It inflates, it deflates, it records, and on the screen it shows you what your BP is. So this is what is very user friendly. You can train your patients to do these at home. They don't have to come to you. They can buy and do that at home. And documentation of diagnosis tests carried, you can document them to show that you are promoting all these activities and trying to and you can guys, when I say all these things, you don't have to do it for free. You can charge them, but yet the patients will be much benefited, because there is no one who normally they would not go to a hospital, and there is no one who can tell them, because if they have BP or blood sugar, diabetes and blood pressure, hypertension are silent killers. You definitely don't know unless something happens so bad and it comes out. So that's why periodical checking of people where there is a family history of diabetes or family history of hypertension will do something good for these young people. Pharmacotherapy monitoring, development of pharmaceutical care plans, patient monitoring, identification of patient-related problems. See, all these things we really don't do in the community pharmacy level, but we do all of these things in hospital pharmacy model. Development of pharmaceutical care plan, we do it. Patient monitoring, we do that. Identification of all these things, probably I don't have to explain them, but interaction with prescribers, all these things you do in your 5th year clerkship and 6th year internship program in the hospitals you're working. So this comes under stage 2 of the program. Then research and professional development, participation in research projects. In 5th year you do project. Participating in the project will tell you how to carry out a project and how to read an article and use the information given in the article for the best care of your patients. Right? Participate in continuous professional, that is CPE, continuing education credit, CE we call that. Again, in India we don't have that, but unfortunately That is how India is. Sorry to say that, but any of the foreign countries you take, America, Canada, you have to do 30 continuing education credit every 2 years to be able to work as a pharmacist in that country. Even doctors need to do continuing education credits in any of the advanced countries because the developments with the medications, the advancements, new technologies, they change all the time. Whatever you read 10 years ago is not what it is right now. So they want you to be ahead and at par with the latest developments in pharmaceutical industry. So for that, they need you to go for continuous professional development activities like continuous education programs and quizzes and all those things. Audits, this is a very important thing. Development of quality manuals for the pharmacy system. See, especially when you want to catch a mistake, the best way to catch mistakes and correct them is audit. Keep on doing audits. What audits? I'll show you what audits when I teach you actual PDQ self-assessment questionnaire. This is just what things you can do at stage 2. Running audit exercises for services provided, self-audit. So there are two kinds of audits I already told you. An audit that is done by a third party, outside people, and an audit done by yourself. So normally what we do is before somebody else comes and audits us out, we do a self-audit to make sure do we stand where we are and what the other person's expectation is. So this is something you have to do on a frequent basis because here we don't do that. But in US, every month we do C2 audits. C2 are controlled drugs like your OxyContin, Oxycodone, hydromorphone, your fentanyl citrate patches, your all these things. Adderall is amphetamines. All these are controlled drugs. So you do an audit every month to make sure whatever you received, whatever you dispensed, whatever is back on the shelf matches, such that you don't run into losses or you don't get into troubles. Then quality care standards, this is stage 3. So if you meet stage 2, the next level, because I said it is a continuous improvement process, you can't say that, okay, I implemented this system, this is the best. Because all of you are aware of that. Whatever the phones you are using now are not there few years ago. When cell phones emerged out, the first cell phone is pretty, big, huge, heavy phone. And it only is useful to just make voice calls. There is no text message, nothing. After that, you have these feature phones where you text and message. Now we have smartphones. So having a smartphone is like you have a bank, you have everything. You have a computer. See, just now, my computer, my personal laptop, my personal system in the office has some issue. It wasn't working. Immediately, I connected to the phone. So this is what I'm saying. The technology keeps on advancing, and if you don't keep in touch with the technology, you get outdated. So that's why this is a continuous process. Okay, so domiciliary services, provision of pharmaceutical services to housebound persons, nurses. This is something where you can't even think about because we don't see much of these things in our. We see some of these in metropolitan cities, but not in tier 2 and tier 3 cities in India. Like provision of pharmaceutical services to housebound persons, nursing homes, where a pharmacist or a nurse goes to the patient's house and renders pharmaceutical care. This is called domiciliary services. This is again a good quality initiative, which is already available in all advanced countries and also some metropolitan cities in India. Online services. Provision of online pharmacy services. We have a lot of online pharmacies. When I say like don't look for these 1mg or NetMeds, they are okay to some extent because normally I would not recommend using an online pharmacy because I always recommend you to walk into a pharmacy because it gives you a nice opportunity to interact with the pharmacist, ask more questions, know better about your health and clear all your doubts. So, but here in the provision of online pharmacy services is where you are taking your routine maintenance medication, like you're taking metformin for the last 10 years. Again, you know everything about that medicine. Maybe if you think you cannot go to the pharmacy, maybe you can once in a while upload your prescription into these websites and receive your medication. But this is also one of the latest updations and improvements we recently see in India. System maintenance and update. Your system, your pharmaceutical system, your dispensing system. In India, we don't have dispensing system. We just have a point of sale system. And please, students, remember that your dispensing system is different from point of sale. What is the difference? Your dispensing system will have everything what I was talking before, the patient history, drug history, everything. Whereas your point of sale will only have what drugs, when you sold, how much you sold. That's it. It doesn't contain anything more than that. But your dispensing system will contain the doctor's name, prescription, when was it prescribed, what are the patient's address, phone number, patient allergies, patient specific conditions, when were the refills filled, everything about the patient. So that is the difference between these two things. Handling requests and website. Yeah, if you have a good pharmacy, you can run a website and you can handle the request on the website. Pre-registration training, acceptance of pre-registration training. See, suppose I'm working in this hospital and I thought, okay, let me do a pre-registration for training for PDQ. See, what all I'm teaching today is more of a theoretical thing. But if I decide, okay, let's do a mock PDQ certification program. So let's do a workshop. That is pre-registration. So I can have some trainees come in, I can say that this is what I'm trying. I'm trying to build quality into the young budding pharmacists so that when they become pharmacists, they tend to follow proper protocols and proper procedures to build quality in their practice and provide patients with the best pharmaceutical care. So I can do that. Monitoring and documentation of requirements, activity description for trainees. So that's what we do, right? In the hospital in your 6th year, we monitor and document whatever you document, we monitor it. And we give you a description. Okay, you are working, suppose you're doing crash carts. We tell you what to do in a crash cart. When you're monitoring and checking drugs in a crash cart, what to pull out, what to look for, all those things. So when I'm training you with something, I give a description of what I'm trying to train you. So that is activity description for trainees. That's all, again, registration training, pre-registration training programs. Any pharmacist who wants to build a good quality into their career, into their hospital, they can do these things. Then parapharmaceuticals, availability of medical devices. See, like yesterday, one of my students came to me. She had a twisted finger because of an injury while she was playing. We took an X-ray. God forbid, unfortunately, there is no fracture, but she needs to wear a finger cot. So how many pharmacies carry a finger cot? Hardly, very few. Only surgical shops carry these things. And how many pharmacies carry glucometers? Nowadays we see like MedPlus and some chain pharmacies are carrying it, but not every pharmacy carries that. So these parapharmaceuticals or anything that works around the drugs, like you take a drug, you want to measure something, like cholesterol measuring devices, sugar measuring devices, blood pressure glucometers, sphygmomanometers, all these things. And your peak flow meter, all these are parapharmaceuticals. Homeopathic products. Sometimes people use multiple medication systems, right? People will be using allopathic, they'll be using herbal, they'll be using homeopathic, because people keep getting recommendations from different people. So you have to keep a close eye, because some of the herbals don't do so well with the allopathic system, and some of the homeopathic system doesn't do well with your allopathic system, because usually homeopathic and allopathic are quite opposing to each other. So technically, to make it easy for you, I'll tell you a small example. Suppose if you have watery eyes, your eyes are tearing, right? So normally what we do is, in allopathic system, we use a histamine blocker to stop the tears and stop the flow. What homeopathy does is, there is a primer and priming. So what they do is, okay, your eye is trying to get rid of something, they make the eye water more, thinking that, okay, if that happens, whatever it wants to get rid of, it get rid of that, and it becomes normal. It's two different ways of addressing the problem. So normally homeopathic and allopathic will be fighting against each other. So that is the most important thing you have to keep on an eye if some of the people are using both allopathic and homeopathic modes of systems. Okay, and display of parapharmaceuticals. Nowadays we see that in pharmacies you see beautifully arranged glucometers, various colorful thermometers, pulse oximeters. Nowadays you can buy everything in the pharmacy. You can buy a pulse oximeter, you can buy a peak flow meter. These are all, because how would somebody know you're selling them? By displaying them. Information. And not only just selling them, you also have to train the people how to use your pulse oximeter. Normally, pulse oximeter, people put in any finger. That is wrong. Ideal finger is your middle finger. Middle finger is the right finger to put your pulse oximeter to get the correct reading, because it has dual supply. See, all these small things, you don't have to do a great thing to really make look things great. Every small thing you do can give you great results. Remember that. Customer perceptions, external what? Views of patterns on service provided. Hey, most of you, if you visit a pharmacy, how many times if you have you experienced a pharmacist asking you, how is my service? You will be shocked, right? If you go to some pharmacy and they ask you, after all the thing they help you with, how is my service? Because we never hear that in India, but that is what we do in America. Every patient who comes, sometimes maybe you know that if you are calling Amazon customer service or some customer service, right? After they talk to you, they'll ask you, how is my service? Can you please provide a rating? This is what I'm saying. The same thing for pharmacy. Now, do you have the guts to ask a patient, can you rate me? Yes, if you provide the best exceptional care. Okay, then expectations of patrons from pharmacists. How do you want your patients to be? I mean, yeah, because you're working for the patients. Patients don't like waiting long. Patients don't like cluttery environment. Patients don't like many things. Like they don't want you. Some of the patients they don't want you touching their medicines. I mean, if you are dispensing from a standard containers with your hands. So all these things. There are so many things patients have expectation from a pharmacist. I mean, some patients don't like their medications dropped on the floor because it is a medicine. So they look at medicine in that way. It's a small thing, but they don't like it. So you should meet your patrons' demands and requirements all the time to build this continuous quality. My final conclusion from this is you are obliged to ensure that services providing to society are of appropriate quality. Quality care standards are tools with which to measure the quality of service provided, and don't look at them as a necessary evil, because sometimes like plants, transpiration is a necessary evil, we say that, but without transpiration a plant doesn't get water. So all these quality measures sometimes feels like that is too much. You have to wear a nice smock, I mean you have to sanitize your hands, you have to sanitize your desk, you have to sanitize your spatula, your counting tray, all these small things. You have to make sure drugs are dispensed at the highest level of purity, right? Some things mean necessary evil, but don't look at it as necessary evil, but this is a very, very important aspect to dispensing. Now coming, after giving you this much lecture on how to build quality, what are the various steps and stages of continuous quality improvement process program, right? I'm going to talk about PDQ. Now with that basic introduction of what is quality, how many types we have quality, how to implement quality, what can you do to provide the best quality. Now, this inspection is based on all the driving things I have said in the last couple of slides. So here, in this certification, whoever the inspectors come, right, they will be looking at these 8 standard parameters. There are 10 standard parameters. They'll be looking at these 10 standard parameters. They are, how the administration is, how the facilities are, who are the personnel working there, procurement and inventory management, how are you procuring and managing your inventory, storage and inventory management, drug dispensing, distribution and control, process, drug information and extemporaneous preparations. This because drug information is a process. Extemporaneous preparations are a process. What are the processes you do in your pharmacy? Quality system. What kind of quality system you observe and practice? Health promotion and ill health prevention. So how do you promote health? How do you prevent ill health? And lastly, patient counseling and therapy management. So these are various standards. They don't tell you how to do. It is like your NAC or NBA inspection. They don't tell you it has to be like this. They will ask you, how are you implementing these things? That is the question. Because they'll ask you every question when they come for audit and inspection. The inspection normally takes anywhere from, I would say, 7 to 8 hours from morning to evening, depending on how nicely you maintain your pharmacy and how nicely your workflow is. So they'll ask numerous questions. On the day of the inspection, they'll have an auditee. Auditee is a person where they don't ask questions to all the people working in the pharmacy. They'll choose one person. They'll ask that person who works in the pharmacy to be with them. They will ask all the questions to that person. That person should answer to everything that is being asked by these inspectors who come for the inspection. Okay, so that is a very, very important thing, because these days if you go to any hospital, any good standard hospital, the first thing they ask you is, seriously guys, they'll ask you, do you know anything about NABH? First question. Do you know anything about MOM, Management of Medication, which is a regulation of NABH? Next thing they'll ask is, if it is even a better hospital, what do you know about JCI? What do you know about MTM? What do you know about management of medication? What do you know about interventions? This is what they ask in JCI. And next question they'll ask is your pharmacy, does your pharmacy have any certifications? Or are you certified from any agency? So these are the various things they ask, even for interviews. Do you know PDQ? What is PDQ? How do you maintain PDQ? So this is a very important aspect every one of you should know if you have plans to join a very good hospital, that is especially a hospital that follows the highest standards in the country, that is NABH approved hospital, or highest standards in the world, JCI hospital. So these are the things they want, that they don't want you to just come and dispense medicines and go. So if somebody asks you how many standards are there in PDQ, if you don't know, the chances of you getting a job is very less. That's why I'm saying you have to be updated with the latest updates, latest things that are happening in the current scenario. Okay, so these are all the 10 standards. I'll go one by one. Please don't be puzzled because I'm trying to speak everything, the entire inspection process I'm going to cover right now. But if you have any questions, please keep them till the end of my presentation. I will answer them on 1:1 basis. So I'm taking the first standard, administration. You see two columns. Please everybody listen. The first column is the checklist. Checklist to verify the effectiveness of the pharmacist or the pharmacy department. So this is the checklist. The second column is checkpoints. So how do you implement these checklists? By checkpoints. And next will be your hospital comments and conclusion. See, this is a self-assessment questionnaire. If you are going for PDQ, you have to keep this with you. You have to go by each standard, each question, each checkpoint. What is your answer? So if I tell you that this is a tabular column, I'm only showing you two columns. The rest of two columns will be hospital's comment, and the next column will be conclusion. Okay, so first I'll show you, I'll just go with one thing. What is the first important thing is administration. That is the first standard. A pharmacy shall be conducted under the continuous personal supervision of a registered pharmacist whose name shall be displayed conspicuously in the premises. You know that, right? Without a pharmacist, a pharmacy cannot be opened, right? This is the standard in administration. How do you check? So when you go to the pharmacy, this is the rule. So check for pharmacy management and staff details. Check for registered pharmacist certificates. Whoever is working in that pharmacy are the pharmacists. Because if you see them, your registered pharmacist certificate will have their photo and picture. So check that. Check if you see that our pharmacist working in the pharmacy. Okay, then check if organization chart. If it is an organization, like if it is a big corporate hospital, they maintain all the certificates in a central area. So they won't maintain in the pharmacy, but they'll maintain in a different area. So check with the organization chart if available. Then what will be the comment? There are 7 pharmacists working. First thing, are 7 pharmacists registered in that state? Yes or no? Second thing, do they have their registered pharmacist licenses in a valid condition, not expired condition, invalid condition? That is your second question. Then you conclude. How do you conclude? Whatever this particular checklist we are looking at, checkpoint, is it conforms to the standards or it is non-conforming to the standards? Opportunity for improvement. So there are 3 aspects here. C, NC, OFI. That is the codes we use. C is conformity. NC is non-conformity. OFI is opportunity for improvement. Suppose if there are 7 pharmacists, there are 7 certificates. Yes, perfectly matched. All 7 certificates have validity. C, conformity. Non-conformity, you don't have certificates. So it's non-conformity. Suppose there are 7 certificates, but 7 certificates were not displayed on the wall, but they are putting it under the desk. Here what you can say is opportunity for improvement. Why? You can tell them, hey, why put it in the desk? Why don't you put it on the wall so anybody can come see it? This is opportunity for improvement. Okay. So this in this wise we have 10 standards. I'll quickly try to cover all these 10. So the second thing in first standard administration is hospital pharmacy management shall define the roles and responsibilities of pharmacists. Overall staff and accountability needs to be determined in each role. How do you find that whether they define or not? Check for roles and responsibilities. How any pharmacy you go, the hospital will give a role and responsibility. You're a pharmacist, this is your role. You're a technician, this is your role. You clean pharmacy, you're a cleaner of the pharmacy, this is your role and responsibility. So you have to tell them the roles and responsibilities. So that will be in a printed paper. So if they ask you, they have to show you the paper. See, this is my role and responsibility. If that is there, good. Then check if there are goals set for the pharmacy and a strategy plan in place to achieve them. So suppose if I say pharmacy has to be neat all the times, you have to clean the pharmacy 2 times a day. That is the goal I put. So did I put a strategy? What will be the strategy? Okay, every day morning 9 a.m. you clean the pharmacy, 9 p.m. you clean the pharmacy. The strategy is 9 o'clock we will make a phone call if you don't come, and even 9 a.m. and 9 p.m. we are going to make a phone call if you don't come and clean it. That is the strategy to make sure they come and clean the pharmacy. And this is a small example I'm trying to set with cleaning, but there are so many goal strategies you can fix, and how to achieve those goals. That is the most important thing. You can say, I will do this, I will do that, but you have to prove them. How are you going to do that? How are you going to achieve them? Third one is hospital pharmacy management shall ensure that appropriate facilities, trained personnel, standard dispensing practices and documentation procedures are in place in the pharmacy for supply and dispensing of prescribed medicines and other healthcare products. Yes, this is very important. How do you check them? Check available area, staff, licenses, permits for pharmacy. Then, do you have any SOPs? See, in the lab if you go, right, probably in your B.Pharm college, if you have been to the college, if you go to the analysis lab, behind every instrument there will be a SOP. How to use that equipment. Okay, what it says, first turn on the power, wait for the light to come, do the sanitization, do the validation, everything will be written, how to operate that machine. Similarly, here there will be an SOP. Suppose you are making a suppository, list of instructions. It should be posted on the wall, how to make that. That is SOP. Training records. Guys, when they come, I told you, quality is a continuous process. It is not a one-time process. They will see how many times you have conducted classes to the pharmacists and the pharmacy technicians working in the pharmacy and updating their knowledge. Okay, you can say that, okay, how I know? Because I am a part of the audit, I am an auditee, and I am also a trainer for all the pharmacists of Ramesh hospitals. That's what I'm saying. That's why I know. I myself went many times and conducted classes and trained all the pharmacists. So how do you do that? Normally, we conduct a pre-test. Suppose today I want to talk about inventory management. So what I will do is I'll conduct a small quiz, a small test of 20 marks. I'll give the papers, they'll answer because they have no idea, much idea, right? So normally they get around 4 or 5 marks out of 20. Then I do my presentation, I teach them for 3 hours, and end of the 3 hours I'll give the same question paper and I will see how many marks they get. So definitely by the end of the presentation, when they answer, they take the quiz, whoever got 4, 5, they will at least get 14, 15 or 16 marks. Some will get 20 out of 20. So this is how I'm trying to say that, hey, initially they are not that knowledgeable, but now I have empowered them with knowledge. So this is what is a training record. You have to maintain those records. How many things you have to do? You have to do at least 24 to 30 training sessions per year is what you have to do to get PDQ. Remember that. Then, hospital pharmacy shall have required legal permission and drug licenses. Obviously, without having a license, without having a permission, right? That is FDA license. See, state again, this is American FDA is Food and Drug Administration. They have a Form 2021, which is a license for the pharmacy, and other permissions as applicable from regulator. In India, what we have is our State Pharmacy Council registration and license. So check for that, whether this pharmacy has a license to dispense medicines or not, because all these things comes under the administration of the pharmacy. Hospital pharmacy management shall take steps to ensure that they comply with the provisions of Code of Ethics for hospital pharmacies. That is very important, Code of Ethics. How do you know? You can ask the patient, hey, are you aware of the Code of Ethics? Tell me, what do you do when something happens? What are your Code of Ethics when a patient comes and you don't have any medicine in stock? What would you do? What would you tell the patient? So there are many Code of Ethics which you can apply for ethical pharmacy practice. Cross-check the actual practices against the code. Suppose if the code tells, okay, if you don't have enough medication in stock, okay, or you only have say 10 tablets where the doctor has prescribed 30, you can give a partial of 10 and ask the patient to come back, pick up the 30. This is the Code of Ethics, because I want to be ethical and help them, because rather the patient go without the medicine, I would rather give enough medicine and ask them to come and pick them back. Again, this only again happens in US because they don't give partial medications in India. Okay, again, so they come back tomorrow, they pick up the rest of the medicine. Now the inspector goes and asks the pharmacist, what do you do if you don't have? So if he is practicing it, he will tell what they'll do. That is how they cross-check it, whether they are doing it as per the protocol or not. Okay, then standard 2 is facilities. This is my next standard. So what facilities? Hospital pharmacy premises. Again, check premises for space, areas, quality of water, furniture, all these things. Is there enough space? Is there enough area? Because it can be congested and cluttery. Quality of water, there should be a sink. Normally in America, in the sink you should get both hot water and cold water. Even that they look at it, not just the water alone. Okay, segregation of areas as required by schedule. Schedule N is your prescription medications. Normally in America we call schedule 1, 2, 3, 4, 5, 6. Again, that 1 indicates narcotics. 2 indicates narcotics because 1 we don't use in medicine. 1 is basically not meant for dispensing. 1 is only for research. Schedule 2, your oxycodone, all those things come under schedule 2. Next, hospital pharmacy management shall ensure that medicine preparation areas are appropriately designed to permit ease of extemporaneous. Yeah, if at all you're doing compounding. But again, we don't do compounding. But if you are doing compounding, they'll see, do you have enough tiles to make the suppositories? Do you have enough powder, enough sterile water? Do you have enough, all these things? Do you have enough, do you have a UV sterilization area to make sure you're conducting this in a sterile atmosphere? All these things, they look into that. Okay, how are you maintaining the cleanliness, contamination, whether the person is performing the preparation is qualified to do that or not. All these things they are going to check. Then, hospital pharmacy management shall ensure that in every pharmacy there is a suitable place for discussing confidential information with customers and patients. So normally we should maintain a secretive area, a privacy area. You should not discuss about medications in front of other patients. So do you have that special area where they can come sit and talk to the pharmacist? That's what they look for, the privacy. Again, this we don't follow in India because we don't have these requirements. Personnel. So when it comes to the personnel, they look at the staff. How are the staff trained, or the training records available? Like I said, so my training records are, I will have an attendance sheet. Whoever comes to my class, they will write their name and sign it and put the date. I will conduct a pre-test and a post-test. I am going to include my presentation, their attendance sheet. I am going to include their pre-test marks and post-test marks, which is a very, very genuine data to tell them that we have made every effort to educate, train our personnel in the best way to provide the best pharmaceutical care. That's what that standard is. Then, procedures. Are all the procedures being followed? Like I said, if a medicine comes to the central pharmacy where they enter into the computer, check against the invoice, make sure they received everything, check the expiry date, and then from there, upon request and intent, they move it to the inpatient pharmacy or outpatient pharmacy. There is a procedure for that. You just can't keep on moving as you like. Again, there should be an indent should be approved. Are these people following the procedures or not? That is what they look. Are they trained to follow the procedures, what they are supposed to follow? Then, each staff member should have clearly uttered responsibilities, which must be performed according to the documentation, standard operating procedures. See, everybody should do their own job. A pharmacist should only do the pharmacist's job, and a technician should do a technician job. A technician should not be doing a pharmacist's job. Like a technician should only put the bottles on the shelf, If at all counting is required, count and put in the bottle, but he should not counsel the patient. So that is what this means. You're checking the roles and responsibilities of individual and actual practice. So what individual person is doing, and as such how the practice is doing. Then job responsibilities. This is also very important. So check if job roles and defined align with actual work and practice as per functions required. So a pharmacist is meant to dispense drugs. A nurse is meant to administer drugs. A nurse cannot dispense and a pharmacist should not administer in a hospital. Pretty simple. So are these people following their jobs? Check if an educator, facilitator and immunizer role allotted in the vaccination programs. See, this is one thing because if vaccine safety, what again? This job is also done by a pharmacist. You can have an educator, a facilitator, immunizer role. Myself in America, I am a chief immunizing pharmacist and an immunizing pharmacy trainer for all the pharmacists of my chain. I worked where I worked for past 10 years. So there will be somebody who will be training all these people, all the people coming into the pharmacy, new recruitees. Are there enough senior most people to train everything about anything, about where to keep the vaccines, where to keep the insulins, how to arrange the drugs, how to maintain the pharmacy and all those things, because this is everything deals with personnel. Next, procurement and inventory management. This is very, very important because remember, if you are a good pharmacist, you should never be out of anything. Means anybody comes ask any drug, you should not say, I don't have this. Sorry, I ran out of that. Means that is a very poor, bad practice. So how do you procure? So I'm going to just talk in general. If you guys, you can read my slides, but I'll talk the practical aspects. You can read and listen to me. So how do you procure? Do you have a provider? Do you have a supplier? Who is your supplier? Do you have a warehouse? Where do you get your drugs from? Is that fellow registered? Is he a registered supplier? All these things, because whoever you are buying from, he should be a genuine person. Otherwise, there is a chance for all the duplicate drugs coming into the market. So it is your responsibility to procure drugs from a genuine source and an authentic source or authentic wholesaler or a redistributor. So check records like your purchase receipts. See, you cannot buy drugs wherever you want and sell in the pharmacy. Suppose there is a drug which is 1,000 rupees or 2,000 rupees. See, if you are selling it to a patient, right, you have to buy from a wholesale or a warehouse. Without buying from a warehouse, how are you going to sell in your pharmacy? Means this is maybe a non-authentic one, or you are trying to practice illegal ways of dispensing or something like that. So they'll check, okay, you ordered 10 from this company or from this manufacturer, okay, you use dispenser 5. Do you have 5 on the shelf? Yes, I have 5 on the shelf. This is what they check. They check the receipts, purchase orders, invoices, all these things. Ease of traceability. Yeah. Suppose if I say I ordered this much in January, I ordered this much in February, how do you trace them? Using a computer databases, like everything. If you put in the system and you can keep tracking it, your system will give you how much you ordered, when did you order, what is your perpetual inventory right now, all those things. Because all those things probably in community pharmacy you have studied minimum order level, reorder level, all those things you can only do if you know how to manage the inventory. Then only you can keep every drug in stock at all times, such that whenever a patient comes, they don't have to go back. Because remember, every patient, if they come to your pharmacy and find out that you don't have this drug, chances are they won't come back to you anymore, because that is the impression they have. Oh, these people are not going to have these drugs anyway, so let me go to some other pharmacy. So always make sure, don't have stockouts, have enough inventory. Again, if you keep too much inventory, you'll be losing money. If you keep too less inventory, you will be losing patients. Remember that you can't lose money, you can't lose patients. That is a good way of procuring and inventory management. What is the lead time? If you order, in how much time you will get that stock? Do you have enough time to order? What is the days on hand? How much stock you have on hand? All these things you should be able to find out to be a good pharmacy manager. Then, authorized dealers or manufacturers from whom, I told you cannot buy from somebody. Whoever dealer you are buying from, they also have to have a pharmacy license. So that is what they check. What kind of inventory management tool? Yes, do you use a manual one or a computerized one? So normally all big hospitals use computers to stock or maintain inventory management, do inventory management and maintain inventory of all the drugs. Check strategy for purchase. That's what I'm asking. They'll ask you, what is your minimum order level? I say my minimum order level is 3 days. I mean, say for 3 days, I keep my stock on hand is 3 days. My minimum order level is say 10 bottles. Means 10 bottles are going to last for 3 days. They'll ask you, okay, end of third day, how are you going to get your items? So again, you have to tell how you are maintaining, how are you ordering, and what is your contingency plan. Means you are buying your drugs from person A, and A ran out of medications. Then you buy from B. B is your contingency plan. How are you going to procure them when there is a shortage? This is what they check. Okay, and how do you prepare for pandemic? Sometimes there is a pandemic. How are you going to prepare? They ask all these questions in PDQ inspection. So you have to train them and you have to tell them how do you handle those things. Storage inventory management. Again, how are you storing? Are you storing in a room temperature? In summers, if the temperature is going high, means the medicines are subjected to odd temperatures, and there is every chance that the medicine could go bad. So your pharmacy should have an air conditioner to maintain a proper storing temperature. So they check all those things. What are the list of controlled substances available? Do you have a narcotic drug under lock and key? Who has the key? Who opens it? Who has access to it? Yeah, and is there a book to log whatever the drugs that come in and whatever the drugs you dispense? All these things they keep checking it. They check the central pharmacy, they check the outpatient pharmacy, they check the inpatient pharmacy. So this inspection is done in the entire hospital wherever drugs are. That's how this inspection goes. Then they also check for expiries. If you have any expired drugs, or how are you identifying them? How are you removing them? Suppose if you cut a strip, how do you identify the expiry date? Because the expiry date is gone with the patient, you have the last part remaining with you. They are very serious about those things, because if that is expired, you would never know. So we have to design our ways to make sure whatever we keep the medicines on shelf, they have suitable expiry date, or we have to put them in a small Ziploc bag on a paper, writing the name of the drug, batch number, manufacturer name, manufacturing date, and expiry date, such that that paper serves as our record about that medication. If we don't have the actual expiry date present on the strip or on the medicine. Procedure to identify expired medicines. Yeah, how do you identify? How do you dispose them? All these things. Recall. I told you there are 3 kinds of recalls: warehouse level recall, community pharmacy recall, or community or hospital pharmacy recall, and patient level recall. How are you getting those medicines back, and what are you doing? All those things they ask. And how do you dispose waste medications? Medicines are waste. How do you dispose them? Do you have somebody, a third party, who can dispose these medicines for you? Who are they? Do they have a license? Do they have a permission from the pollution control board? All these things. Even if you are giving the medicine for destruction, the person who is taking that medicine for destruction should also have a license and be authorized vendor to destroy those expired medications. So they look at all those things. Then drug dispensing, distribution control. They see the distribution procedure. Like I told you, in my hospital, all the drugs will arrive at central pharmacy. After they arrive, we check with the invoice. Every drug is checked against the invoice to make sure the right drug, the right dose, the right drug and the right quantity and right dose is arrived. Then we log them into our computer system. We log them. So we enter them. After it is entered, we get indents from the IP pharmacy, from OP pharmacy, right? Once we get those indents, we supply those to that particular system. And how is it supplied? Our hospital is one of the best hospitals in the area with the pneumatic tube system. So if it's a small thing, we have a pneumatic tube which runs across the entire hospital. We put in a small capsule and send it. Otherwise, we have a trolley. We put in a trolley and send them to the concerned department with the staff who works in the pharmacy. That is the distribution procedure. That's supply against prescription. Check written procedure for distributions, records. Again, everything you have to have a procedure. This is how you have to do. This is how you do. So ease of traceability of all transactions. So I get a purchase order or I get an indent. I file all those things. So tomorrow after 1 month, I want to see the indents. I have a proof that this is the indent I received. So they check whether you have proper protocols, you maintain the purchase orders, receipts, invoices, all those things. Check procedure for dispensing of medicine prescription handling. That is very important. How do you dispense? So we can say that, okay, we have 2 windows. The first window is a drop-off window. The second window is a payment window. 3 windows. The third window is a delivery window. So a patient comes to window A. We collect the prescription. We ask for any patient-specific information. we dispense all the drugs, put them in a bag in the billing counter, and the whoever is billing will collect the money. After the money is paid, we move the bag to the third counter, which is the dispensing window, where the drugs are dispensed from that window and given to the patient. And at the time of dispensing, we normally do patient counseling. That is what is our workflow. So you can describe the workflow the way you want. See, all they see is whatever the things you do without causing any harm to the patient, and they are more. You're building more quality into the work such that errors won't happen. Okay, that is what is drug dispensing distribution control. Process drug information. Again, we don't do these compoundings, so because this is usually practiced in a lot of foreign countries. So they have to follow these regulations because Bureaus Veritas is an organization. They do audits across the world, not just India. They do in Philippines, America, Canada, Bureau Veritas. Okay, so those are the people they have. This is what they look at. So that's why this thing includes almost every country of practice. Okay, so we take what applies to us and we leave what don't apply to us. Okay, but there are some things which we do that. We do drug information. Like what do we do? Because we don't do compounding in our pharmacies. So that's why I'm not going to focus much on that. Because if you're doing compounding, there is again a lot of requirements. Do you have a license to compound? Where do you get your raw materials? How are you storing your raw materials? Okay, all those things. Okay, but we are not doing that. Let's not waste time. Let me go to the next thing. Quality system. This is very, very important, guys, because this is what checks the quality policy, how a hospital is going to implement its quality policy. Just like in a house, suppose your mom is making sweets and savories for a festival, right? Your mom, or even if they are making pickles, they try to incorporate lot of quality because they want them to come very well. They want them to come out well, with very tasty way, and they should be able to store them. We should be able to store them for a few days such that they don't go bad. So if you want a product that is nicely tasting nicely tasting sweet or a hot, and that should be preserved for a few days, you need to put that quality when you make it. Okay, like suppose if you're making a mango pickle, you get the best oil, you get the best mangoes, you get the best rice flour, because every ingredient adds quality to the final product. So that is the quality policy here. So what is the audit policy? How many internal audits are you doing? How many external audit means any person who comes from outside the pharmacy. Suppose a person from the operation theater, OT department come and do an audit, external audit. If you are doing in your own pharmacy, then it is your internal audit. So how many internal audits are done? How many external audits are done? So what was found out in the audit? And all the problems that are identified, how are they addressing? All these things they look into that. Then check whether all necessary statutory documents, regulatory licenses, registrations, permissions, all this. See, if you want to open an IP pharmacy has its own special permission. OP pharmacy has its own special permission. Central pharmacy has its own special permission. You can't have one pharmacy permit and open an IP and OP pharmacy. Why? Because a pharmacy, a designated area is itself a separate entity. It should have a separate license. Why? One more reason why we have IP OP is the level of tax. A medicine that is meant for inpatient has a lesser tax by the government, that is GST and CGST and state government SGST, right, than a medicine that is dispensed in the outpatient pharmacy. That is why we need to maintain these separate units to comply with the government regulations. The taxes are different. The medicine is the same, but the taxes imposed on the medicines from the inpatient pharmacy is less than the tax imposed on the outpatient pharmacy. So this is where you're trying to abide by your government rules, laws and regulations. Okay, then the hospital complaints. Check complaints handling policy. That is very important, guys, because if you have any complaint, how are you addressing the complaint? Okay, you addressed the complaint. Did that same problem happen again? And check your product recall policy. Who informs you? Who pulls the stuff from the shelf? Who is going to pack it and send it? Is there any occurrence? So if somebody you got a recall, how did you do the recall? Tell us. That's what they'll ask. And then if you do it, you have to maintain a record. They'll check the record. Whatever you do, whatever you say, and whatever you show, all three should be same. They should not conflict. Health promotion. This is very, very important thing. Now we are distributing vaccines. How do you do that? Preventive care activities, initiatives taken like campaigns, medical camps, wellness camps. What did you do to promote health? They'll ask you. So you should be able to, hey, I checked blood pressure, I checked this, I checked that. This is what, and how, what materials did you use? What education materials you gave to the patient? All these things they'll ask, because a pharmacy or a pharmacist is the I would say you should profess health promotion. Okay, very, very important. And hospital management shall engage in preventive activities that promote public health and prevent diseases like smoking cessation, infectious and sexually transmitted diseases. All these things you should be able to counsel them. Honestly telling you, anything pertaining to health, you should be able to talk openly to the patient and promote health. Not only just the sanitization process, anything a patient asks, you should be able to answer. For that, you should have a policy, you should have a document, you should have a information leaflet. Okay, that is very important. DOT, that is for directly observation therapy. We do this for patients who are suffering with HIV, patients who are suffering with AIDS, people with TB, tuberculosis, STDs. If you have a program, how are you doing it? See, normally none of the hospitals have DOTs, but if you are practicing it, they'll ask you, how are you managing it from the pharmacy? How are you supplying the medicines? What happens to the medicines that are not used? All these things they'll ask. Then they'll ask for groups. Suppose some of the hospitals tie up with other hospitals, tie up with pharmacy colleges, tie up with medical colleges. They have MOUs to promote these things. So if you have anything of such sort, this is your place to show them. You can say, hey, we tie up with pharmacy people. We all together go for medical camps. We do this, we do that. And they'll ask for pictures. You can't just say, we did that, we did this. You have to show pictures of what camps you have done. And patient counseling therapy management. This is the last one, but very important one. But unfortunately, we don't do much of therapy management in India. So check pharmacy's ability to provide proper information. See, they'll ask you, okay, what is this drug? Propranolol. Okay, then they ask, what is this drug used for? So if you know what it is used for, you can tell the patient more information. Suppose if the pharmacist himself doesn't answer, what information is he going to give to the patient? So this is where they'll question the knowledge of the pharmacist. They'll question the users. Okay, you're saying propranolol is for blood pressure. Fine. Do you know what else this can be given? That is the question the pharmacist has to answer. Okay, maybe severe headache. Yes, very good. So the pharmacist is knowledgeable enough. So the pharmacist is doing a lot of patient counseling activities and he is properly managing the therapy. Okay. In my inspection, they asked the pharmacist, what is this drug? It's metformin. They asked, you know what this is used for? She said, this is used for to treat diabetes. What else? And she was very smart. She said, also to treat PCOD. Very good. Do you know what else it is also used for? Without any thought, she said, weight management. He was so happy. I mean, I trained them, but this is not me. The answer, what the pharmacist tells, builds confidence not only in the patients, also to the inspectors who come inspect the PDQ inspection. So this is what they ask, how much you are thorough with the subject, how much you can counsel the patient, how much you can manage the patient, all these things. Sometimes you don't have to answer right there. They'll ask you, you can go refer and tell me. At least you can refer a book and tell them they are okay. You can refer a book or you can refer an internet resource like Micromedics or Lexicomp or any of the softwares. You can refer and tell them. They don't expect everything to tell from your mind. But at least if you don't know, if you have an option to find out, like if you have a resource like Lexicomp or Micromedics or Sims or something, you can refer and, refer and tell the patient, they are okay with it. Then, what else? All these things mean the same, how much access we have to the medicines, how much decision making you do. Suppose if you are dispensing any insulin syringes, are you training the patients how to use the insulin syringe? If you are giving any inhalation stuff, are you training the patients how to use the inhaler? How well are you communicating with the patient to deliver the best pharmaceutical care is what all they look here. And for everything they keep going, right, guys? They keep marking, giving marks. End of that, they add all the marks and they give you a score. Based on the score, they will give you a certificate, where you are, what your practice levels are, and all that stuff. And here what they check here is check system through which pharmacy management communicates with doctors. Yeah, sometimes a doctor did not write a dose. What do you do? Suppose if you say, I will give what is on the shelf, wrong. So you pick up the phone, call the doctor, check with the doctor, document that, and give it to the patient. So this is a small quality thing you input, you put there. So if anything, any prescription is incomplete, the protocol is the pharmacist should call the doctor, verify all the information with the doctor, document that information, and then only dispense it. This is where you're building quality, not just give something because it only comes that way or it is the only drug we have in stock is not an option. So they check all those things, how you are doing it, how you are providing continuity of care by transferring information on patient's medicines as patient moves between sectors of care. So people move from one place to other place. How are you trying to do that? This is called medication reconciliation, which we do in our hospital. As patient comes, admits in the ER staff documents what drugs the patient is on, what they put. Then when the patient is moved from ER to ICU, again we do a medication reconciliation. The staff there, the clinical pharmacist will check what medicines were given in the ICU and what medicines was given in the ER and what we should put. And when the patient is moved from ICU to the ward, again the pharmacist who is going a ward rounds will check what medicines were given in the ICU, what medicines are prescribed now. So this is called medication reconciliation, which is very much important for therapy management. So these are all the things they use. That they use various tools and tests. Then check for what kind of different tests or tools use for point of care testing. Patient bedside testing. See, sometimes we have bedside echo, we have bedside glucometer to check blood glucose. So they'll check how pharmacist is playing an active role in doing these things. Check and confirm the reliability of these tests or tools used, how reliable they are, whose responsibility and who is going to train them. Because without training, like CPR and all those things, you need somebody to train you, who is taking the responsibility of training and who is taking the responsibility of validating them. All these things, they look into it. And after all the inspection is done, this is what they finally come up with. What they do is, they give you, based on the score you get, they give you a platinum certification, gold certification, or a silver certification. If you get 95 to 100% marks in their inspection, you get a platinum certification. If you get 80 to 94.9%, you get a gold certification. And if you get 60 to 79.9, you get silver certification. I can very well say that there are only very few hospitals in the country who have platinum certification, and we are one of them. So this is our hospital. This is where I am right now delivering this lecture, and it is Ramesh Hospitals, Guntur. It is the first JCI accredited hospital. JCI is Joint Commission International, which is one of the highest standards in the world. So we just got our JCI on 25th of January 2020. And even before going for JCI, we already are certified by PDQ, by Bureaus Veritas, with Pharmacy D Quality Platinum certification. We received a score of 98.6% for our quality we have been reinforcing and doing in this hospital for the past 5 years. And remember, the quality was not built overnight. It took 5 to 6 years to build this quality with consistent hard work by all the department people, pharmacy people, pharmacists, our students who work as interns. Our students do a lot of work in this hospital. They do a lot of activities for the pharmacy department, quality and all those things. And with continuous effort with all of us, we were able to achieve platinum certification for the hospital. And with all the effort of the doctors, management and the pharmacy people, we also got JCI accreditation for our hospital. So these are my references. Thank you for patient listening, and if you have any questions, I'm more than happy to answer for you. Hello, are you guys there?
Yes, sir. So, can we stop streaming, sir, or in
Yeah,
bit?
if you have any questions, yeah, we can stop the streaming. I can answer those questions because for majority of you, I want to show you a demo how it looks like. Yeah, we can stop the live streaming right now, and we will go for confidential thing which cannot be recorded. But I want these people to see how to prepare a PDQ presentation before you get ready with the self-assessment questionnaire.
Yes, sir. So, Alvin, you can stop the streaming. And before that, actually, I have a couple of questions, sir.
Sure.
So, you are the founder dean of PharmD program. So,
Right.
can you just share like what all effort did you take to get approval with Ramesh Hospital and the other background steps before you initiated this program? So, I want
Sure.
students to understand how tough it is.
Getting this approval is not easy at all because when they started this hospital in 2014, this hospital was inaugurated by our late President Abdul